Hi everyone. Our topic today is all about back pain. What causes back pain and what are some of the treatments out there for back pain. And I'm here with Jenny Winters, and she's our physical therapist here at Sumay Fitness. So welcome, Jenny.
Thank you.
So can you tell us more about some of the causes of back pain that when you talk to your patients, what are some of the causes of back pain?
Yeah, so there's several causes of back pain. So we've got our example here. So this is looking at the spine from the side. One cause of back pain is disc space narrowing.
Okay.
A lot of people panic when they go in to get their first MRI after going in for back pain, and their MRI report says disc space narrowing or arthritis.
Yeah.
These are all common with aging. Everyone's discs are going to get smaller.
Yeah.
The problem with that is, so you've got the disc between every vertebrae of the low back. But those discs really help to open up the space for these nerves to come out at every level there. So as your disc gets smaller, those holes for those nerves to travel through also get smaller. And if it gets small enough to irritate that nerve or touch the nerve, that's when you get the issues with back pain or the symptoms down the leg or into the foot there.
So this red here is like what's that? Like a herniated disc?
Yeah.
Yeah.
So this is an example of a herniated disc. You can see there it's pretty close to where the nerve comes out. So any movement that this person would do that would cause that nerve to touch that bulge, you're going to get possibly that zing of pain down the leg or numbness, tingling, any of those kind of symptoms. You don't always have to have pain in the back, but the issue is in the back. So even if you're having that pain that's traveling down the back of your leg, back of the knee, outside of the leg, it's all stemming from the nerves in the low back.
Would prolonged sitting will cause back pain, do you think?
It can.
Yeah.
With prolonged sitting, working on a computer, driving, your hip flexors get really tight in the front. And if you don't address that, it can affect the way your pelvis is. It can.
But this is the front, right?
Yeah.
Okay.
So if your hip flexors are tight, they attach to the front of the pelvis. It's gonna anteriorly rotate your pelvis. You're gonna get a little bit more lordosis or extension in the low back, and that can irritate those lower lumbar segments there.
Can you tell if I have lordosis in my back? It's a bit better now. I used to have more anterior tilt.
Yeah, so what we do is we check where the ASIS, or that kind of hip bone that people feel in the front.
Yeah.
Yep. So we check where that is compared to the back.
The PSI.
And we're looking at that difference in the angle. Yep.
I see.
So we also look at if you've got that arch in your back, but the true kind of measurement is that angle of this to
Compared
this.
to this.
Yep. So if that front bone is a lot lower, we know that it's anteriorly rotated.
Okay. Yeah. So would this too also moves, right? They have
Yes.
separately. Yeah.
So people think of the pelvis as one solid piece, but it's actually three bones. So you've got the two kind of side pieces connected by a cartilage disc in the front, pubic symphysis, and then in the back you've got the sacrum. So the ilium are connected to the sacrum by ligaments here. So if you've got any extra movement, any imbalance in hip flexors to hamstring tightness, you can get kind of rotation where half of the pelvis will rotate forward or back, and it irritates that SI joint.
That's where when one of the hip is a little bit higher, right?
It could be, yep. Because if
So-
one side is rotated more, you're gonna feel the top of this crest at a different point.
Would that kind of shorten their leg too?
It can, yep.
shorten.
Because so the femur attaches in here, that's the kind of the start of the leg. So if you start rotating and moving that position, it can affect the appearance of leg length. If they have a true leg length difference, that'll affect the pelvis too.
I see.
Your body will do whatever it has to do to try to get your eyes
Level.
level. So it's gonna adjust and twist and turn to get those eyes level whenever it can.
Awesome. Wow. It's amazing.
Yeah.
Yeah, so mine is more, it's called spondylolisthesis. So I think L4, L5 somewhere. I think probably L4 or
Yeah.
it
So
kind of moves.
with that, what happens is this whole vertebrae kind of slides
Yes, that's what
forward.
happened.
And what happens there, the biggest risk with that is if it slides too much, it can actually put pressure on the spinal cord.
Yes.
So they kind of grade it if it's slid forward 25%, 50%, or 75%
Yeah.
based on severity. But if you can kind of catch it early, it's not a really traumatic thing, a car accident. A lot
Yeah.
of gymnasts actually get it too from the constant
All the extension.
back bends and extension. But if you can stabilize it and learn to keep that core engaged, a lot of people are able to maintain without
Yeah.
surgery.
Yeah, so that's why I took up Pilates.
Yeah.
That helps stabilize
Pilates
instead of
definitely
surgery.
Uh-huh.
Yes, and you mentioned stenosis, and when they have those tests, X-rays or MRIs, so those are natural degeneration as we age, right?
Yes,
So nothing to be alarmed,
Yeah.
and because people are always alarmed, like, oh, I got this, and
Yep.
yeah, so
Yeah. So research is actually showing too that a significant amount of people, if we were all to go in and get an MRI done, chances are some of us are going to have a disc bulge that's completely asymptomatic.
but no pain.
Yep, you
Yeah.
may not even know that it's there. Where other people may go in and have a very small one and they're extremely symptomatic.
Yeah.
So it's super important not to treat the image.
Yes.
We need to kind of look at the patient's symptoms and go from there.
Okay.
And a lot of times too with the disc bulges or herniations, research is also showing that some people turn to surgery and some people turn to PT and Pilates and
Yeah.
core work.
Yeah.
The initial pain, so I think it was 3 months, the people who had surgery did have less pain. But when you start to look at 6 months to a year, the people that had surgery versus didn't and did the rehab
Yeah.
were very similar. So if the pain is not excruciating, debilitating initially,
Yeah.
a lot of people can rehab disc bulges and herniations without surgery.
Thank you. Thank you, Jenny. So that's our topic today. It's all about back pain and what causes it and some of the treatments, options you have. Thank you again, Jenny.
Yeah.
Bye.